Hello and welcome to Community Care's Mental Health Response Training. My name is Paul Horn and I'm the course instructor, and this introductory video will help you to understand how to take the course, how to pass this course, the items that you'll need and want as you go through it, a little bit about the course's origins and intentions, a little bit about me, how to troubleshoot if you run into any trouble, and how to share the course, whether you want to let friends and colleagues know about it or whether you want to cite it in a research paper. So, a little bit about the module schedule. There are 8 modules in the course altogether, but you do not have to take all of them. You may, and you can take any combination that you want. Once you have selected a module, however, it is very important that you do the module in the order that is indicated. Be aware that this course is offered on a Moodle platform, which means that all activities are tracked and dated, so we can tell what was done, by whom, and when. And it is one of the prerequisites that you do the course in the order that it is laid out. In order to do the course, you'll begin each module with a pretest. Don't worry about whether or not you pass this pretest. Don't study for it in advance. Part of the reason we're doing the pretest is to see whether or not the course information truly changes what people know about mental health. And another reason is connected to adult learning, and we'll talk about that in just a moment. As you go through each of the modules, you'll see that there are video lectures and sometimes other activities that are lined up in a specific order. At the end of almost every video, you'll be asked to do a journal entry, sometimes referred to as a blog entry. The opportunity to do that is provided right on the Moodle page under the forum line, the heading. And this particular blog is viewable by everybody who is currently enrolled in the course, as well as by myself. And that's by design. We really want to see you reading and reflecting on what other people say, and for them to do the same thing with you. So we're most happy when we see people generating discussion. Sometimes people say to us, why am I being asked to do a blog entry before I've actually taken the instruction? And we'll talk a little bit more about that in just a second, but the main thing to do here is to generate discussion and have us challenge our old ways of thinking. At the end of all of the activities, particularly the videos and the journal entries, you'll be asked to do a post-test. And the post-test will be identical for the first 20 questions to the pre-test. So the pre-test has 20 questions, multiple choice and true or false, and those exact same questions will be on the post-test so that we're comparing apples to apples. And there'll be 2 additional questions, and these are open-ended in nature, and they're designed to find out how your thinking might have changed and how your practice might have changed. And so you'll be required to fill out those 2 questions as well. Now, we'll talk about this more in a moment, but the post-test is graded. Now, why do we get people to do a pre-test or blog entries before they've been instructed? The idea is based on an adult education concept called priming or precognition. The idea is to have you be mindful of what you currently think or believe about the particular subject, in this case mental health. And we know based on research that that helps to change the way we think about things much more impactfully than if we simply get taught something without ever thinking first about it. You'll also notice another piece of the course's structure is that there are distinct overlaps or repetitions. And again, this is connected to adult education theory. We know that we're much more likely to learn and embed things and to make use of things if they're repeated and represented in different ways. At the end of each module, you'll see a link to a course evaluation. We would like you to do that course evaluation at the end of whatever module you decide is your last one. It helps us tremendously to determine what's working in the course for people and to revise the course as we move forward. You'll also see a link at the beginning of each module to some slides or handouts, and we absolutely encourage you to print these out. But we do want to give you 2 cautions. First, don't make the mistake that some students have of assuming that if you've got the printouts, you don't need to watch the videos. First, the videos are essential to the course. They are the lecture, and if you're only looking at the slides, you're going to miss a great deal of the content and context. And second, the course does track how you actually go through it. So if you're not watching the videos, it will show on the Moodle screen that I checked later on, and that will mean that I wouldn't be able to do the certificate. The other thing I like to mention about the handouts is that these are copyright. They are freely available to anybody who is taking this course, but they should not be distributed by anybody to people who are not enrolled in this particular course. It's important that you watch all of the videos that you're being asked to watch, and that you do all of the blogs. Now, the videos themselves can be anywhere from 2 or 3 minutes long to up to half an hour long. And what we've done is we've put the length of each video on the actual link so that you can pre-plan and decide whether or not you have time to watch that particular video at the time. And it's important, if you do want to be able to go back and rewind or watch a video again, then you can do that because all of the videos are offered on YouTube. Another thing that we encourage people to do is to study before they do the post-test and to take notes as they go through. Sometimes people do the handouts and write their notes on there. Other times people just use a blank piece of paper. Whatever works for you, but please don't just attempt the post-test without doing any study or taking notes. This is a problem that we sometimes run into where people assume it's going to be very easy, and occasionally people not only fail, but they actually score worse than they did on their pre-test. So how do you pass? Well, you must complete whatever modules you elect to take in the order they're laid out. You must watch all of the videos associated with that module in their entirety. You must complete all the blog entries and other exercises as directed in the videos. You must complete the pretest. Again, it's not important that you pass it, but you must complete it, and you must complete it before you begin doing the instructional activities. On the post-test, you must score at least 11 or better. And again, this is why we would encourage you to do your studying. Once you're done all of the modules that you intend to take, please write to me using the link provided on the page, and I will go back and verify your work to make sure that you've done it and met the requirements of the course. And when that's happened, I'll send you a PDF version of the course certificate. We really want to stress to you that it's important that you take the course and do it as it is laid out, because our aim is to improve mental health literacy in our community. It is not about providing the certificate for us. We're happy to do that when people have proven that they've earned it, but we are really not here to try and help people to improve their qualifications. Our main interest is in helping the community to be better versed in mental health. In order to take the course, you will need to sign on at an account, and that account must be registered with us at our website, communitycarestraining.com. Do not attempt to create an account directly through Summit Learning Center. That will not only not work, but it will actually make it very difficult for us to actually create an account for you later on. You'll need a reliable internet connection because, just like this video, most of the course is delivered through online streaming video. You'll want to have a watch or some sort of timer, because when you're directed to do your blog entries, you're almost always given a specific amount of time to spend on this. This is not because we're trying to be bossy, but because we know the amount of time that the course is designed to take, and if we can keep you to those short journal entries, we will be able to accomplish our aim of getting each module completed in 3 hours or less. You'll also want some form of writing implement so that you can keep notes as you go along. And you'll want to have 3 hours set aside to do a module. Now, you do not need to do those 3 hours all in one setting. You can do it at your own pace any time of the day, and you can do it in small increments. Some people do it in 15-minute sittings, while others sit and do each module one day at a time. And that's entirely up to you. And again, I must stress that you complete all the activities in the order specified in order to pass the course. You cannot go back, for example, and do your blog entries after watching all of the video, nor can you go back and do the pre-test after you've watched all of the videos. In addition to the things you may want to print out the slides at the beginning of each course. As we said, that's optional, but you can do that. And you may want to work in a partnership or team, and we strongly encourage this. So if you have a partner who has a computer and you both want to turn on and be on the course at the same time, that can be a great idea. And in some cases, we're contacted by groups or partnerships that have asked if they can present the course on something like a video projector and then have people enter their blog entries or test scores on their own accounts. And that is absolutely something we welcome seeing. We've had families, we've had mental health clubhouses, we've had classrooms, we've had agencies, we've had a whole host of community groups all do it that way. And not only are we okay with that, but we believe it works even better than taking the course as an individual, because again, the idea is to generate discussion. It is important to understand that if you do decide to do this in a team or partnership, you will still be required to do the pre-test and post-test, as an individual. So each person on the team will need their own account. Sometimes when we hear from groups that want to work in a partnership or team, they ask if they can do their journals in writing and then send us the compiled journal later on. As long as you get pre-approval from me ahead of time by emailing me, I am usually able to work with that without any issue at all. But please do email me before you decide to undertake that approach. You may also want to have a dictionary as you go through this. We've made every effort to try and ensure we are clear about vocabulary, but just in case we have used a word that goes past you, you may want to have a dictionary, or even better yet, a student's dictionary of psychology. A little bit about the course's origins. The course was first developed in the spring of 2013 as a result of research and project work undertaken by a group called the Mission Healthy Community Council. That group has since been redesignated as the Mission Community Health Partnership, but it is essentially the same group, and it is comprised of all of the social welfare and healthcare and educational agencies in the community of Mission, British Columbia. Now, Mission, British Columbia, on the surface of things, is not a particularly remarkable looking community. About 38,000 people, and we are in the southwest corner of British Columbia, Canada. But what makes us unique is that we are a very collaborative community, and we work hard at trying to innovate and address social and health issues in an active way. And this particular course is an example of that. It arose out of research done in our vicinity that demonstrated a need to improve the literacy of the community, of both professional and lay people, in terms of their ability to respond to people who are experiencing mental health crisis. And we have since seen this course be adopted by people all across Canada and indeed the world. And we really strongly encourage you to share this community project in your community and to personalize it there. As you're going through, the video may ask you to check out agencies in the local community. And in the origination of the course, we were referring to the Fraser Valley and Mission in particular. But if you're living someplace else in Canada or the world, we would really strongly encourage you to take the direction referring to it as your own community. We encourage that strongly. This course is supported as a project of a variety of sponsors, and our sponsors over the years have included the District of Mission, the Community Action Initiative, the Division of Family Practice here in Mission, CUPE Ontario, Pleasant View Housing Society, and a number of in-kind sponsors. If you're from an organization that is interested in seeing the course continue, it is entirely funded through donations. So by all means, feel free to reach out to me and we can discuss that further. The course's aim is to improve mental health literacy across the community at the community level. It is not our first priority to provide people with certification. While we do provide certification, that is not our main aim. So we really want to see the community become better versed at supporting people who have mental health needs. And as you'll hear in the course, that is a very common thing for people to experience. Mental health is an issue across all of our community, and it affects all of us. This course is aimed at both professionals and lay people. It takes the perspective that all of us are at some time or another a first responder to somebody experiencing a mental health crisis. It could be our child, our neighbor, our worker, our parent, or even ourselves. And the course is designed to help shape our attitudes, our knowledge, and our skills, to really truly give you some practical ways of supporting people when they're in crisis and in the time after you've supported a person through that mental health crisis. This is a continuing education course. It is designed to give people a basic foundation if they're lay people and to augment the skills of professionals. It should not be seen as a replacement for taking a college level certification. While I am a college instructor and I'm delivering information that is acceptable at that level, this course is delivered over 24 hours and should not be confused with a course that would be months or years in length. A little bit about me very briefly. My name again is Paul Horn, and I have more than 30 years of experience working in the community living and mental health sectors, meaning I have supported people with developmental disabilities and a host of mental health needs, as well as physical health needs, over the course of my career. I'm also currently employed and have been since 2001 as a college instructor here in Mission, and my job on a daily basis is to instruct people to go out and be community support workers and educational assistants, working with children and adults who have a host of developmental and mental health challenges. I'm also a certified teacher in the province of British Columbia, and I work in a private business as a community consultant. So in many cases, it's been my pleasure to work with organizations that are providing services in the social network, in the community, to help and improve the welfare of individuals. Those include housing agencies, mental health agencies, healthcare agencies, and educational organizations as well. What should you do if you're having trouble in this course? Well, the very first thing you should do is check and make sure that you haven't received an email and lost it in your spam file. One of the most common things we hear from people is, I didn't get the email that I was supposed to receive. But sometimes people's settings on their internet accounts or their email accounts are so strict that anything sent from a group automatically goes into your spam or junk file. So please check there first and adjust your settings, because if you're not receiving email from Community Cares, then you will not know what to do. If you do have trouble and the answer is not found there, please reach out to me at the link provided on the website and on the course page. I'll be happy to help you. I do, however, sometimes go away on holiday. As well, the Moodle page is shut down for a few days each year to try and be cleaned up and maintained. So watch for notices from me and from the course page throughout the year. Sometimes those do occur. After you have taken your course and have emailed me and received your certificate, you have two choices. You can remain enrolled, in which case when we send out emails to the group, you'll continue to receive them. That's an infrequent thing that happens perhaps once every 3 months. Or if you choose to not have any connection to us at all anymore, simply sign into your account one more time and click on the Unenroll link. And yes, as I said earlier, you can personalize this to your community. If you're writing from Alert Bay or from Winnipeg or from someplace in India, all of which we have had students sign up from, and you want to talk about the services and the community profile where you live, not only is that okay, but we would strongly encourage you to do that. We really encourage you as well to spread the word about this course. It is all about improving mental health knowledge all around this country, continent, and world. And so we encourage you to start a group and share information within it, and to have people sign up at the course website. As we said, please don't direct them to sign up at Summit Learning Center, because even though the course is hosted on their Moodle platform, they are not the ones offering the course, and signing up there will actually make it more difficult to start your coursework. Remember that this course is copyrighted, and if you are using it anywhere in a research paper or essay, please cite it accordingly. This is the way that the course is cited, and you'll see this exact same citation is provided on the page so that you can simply cut and paste it. The only thing that you'll need to make sure is that you type down into here in your particular bibliography whichever modules you're referring to. Remember that the aim of this course is to be a continuing education course and is not meant to replace a college certification. Our hope is to inspire you to continue on to more advanced training and to pursue that in whatever way is available where you live. Our hope is to inspire you to also spread this knowledge with others, and again, you can do that by sending them to us. And lastly, if you're interested in sponsoring the course and helping us to continue it, it is entirely based on sponsorship donations, and we would be happy to hear from you. In the meantime, we really hope that you enjoy the course and find it useful. Please feel free to let us know if you have any challenges at all, and get started anytime you're ready. Thanks again.